Have your legs ever suddenly felt weak, like they might give way under you? It's not just uncomfortable. It can be a serious warning sign from your body. For seniors, sudden leg weakness can have many different causes. Some are temporary and harmless, while others might point to a deeper issue that needs quick attention. Today, we'll explore 11 important reasons why your legs may suddenly feel weak. Let's understand each one in simple, clear language. First, nerve compression in the lower back. Your spine contains nerves that travel down to your legs. If one of these nerves gets pinched or irritated, your legs may feel weak, heavy, or unsteady. This is often caused by wear and tear in the spine, especially in the lower back. In seniors, age-related changes like slipped discs or spinal arthritis are common reasons. You may also feel pain shooting down one leg, which is a sign of sciatica. In some cases, you might feel numbness or tingling along with the weakness. Long walks or standing for too long can make it worse. Many people feel better by leaning forward or sitting down, which eases the pressure on the nerves. If the weakness appears suddenly or affects your balance, don't wait. Consult your doctor. 2. Low levels of potassium or sodium. Your muscles need minerals like potassium and sodium to work properly. If these levels drop too low, you might suddenly feel tired, weak, or crampy in your legs. This can happen if you are sweating a lot, not drinking enough water, or taking diuretics. Diuretics are often used for high blood pressure or heart problems and can flush out minerals. Even a small imbalance in electrolytes can cause muscle weakness or twitching. Symptoms usually improve once the mineral levels are restored. Eat potassium-rich foods like bananas, coconut water, oranges, and sweet potatoes to help. Stay hydrated throughout the day, especially in hot weather. If you feel sudden weakness and also feel dizzy or lightheaded, check your blood pressure too. A blood test can quickly confirm if your minerals are out of balance. Third stroke or mini stroke, TIA. A sudden stroke or a mini stroke can cause weakness in one or both legs. This is a medical emergency and needs immediate attention. In many cases, the weakness appears on just one side of the body. You may also notice facial drooping, slurred speech, or confusion. Mini strokes or TIAs often last just a few minutes, but they are strong warning signs. Ignoring them can lead to a major stroke later on. Quick medical care can prevent permanent damage and even save your life. If you feel leg weakness suddenly and also have trouble speaking or keeping balance, call for help immediately. Time is brain. Every second counts in stroke care. Fourth, spinal stenosis. As we age, the space inside the spinal canal can shrink. This condition is called spinal stenosis, and it puts pressure on the spinal cord or nerves. It often leads to heaviness, numbness, or weakness in the legs. The weakness might not be constant. It often shows up during walking or standing. Some people say it feels like their legs are going to give out after walking for a few minutes. Bending forward or sitting down usually brings relief. This type of weakness is common in older adults with back problems. Physical therapy, posture correction, and stretching exercises may help. In severe cases, surgery may be needed to relieve the pressure. 5. Peripheral neuropathy. Peripheral neuropathy means your nerves outside the brain and spinal cord are damaged. This is common in people with diabetes, but it can also come from alcohol use, infections, or vitamin B12 deficiency. You may feel numbness, tingling, burning, or weakness in the legs or feet. In some people, the weakness seems to come on suddenly, especially when nerves are badly damaged. The legs may feel like they're not getting the message to move properly. Walking may become unsteady or painful. If you have diabetes, keeping your blood sugar under control helps protect your nerves. Vitamin B12 supplements can help if your levels are low. Nerve pain medications may also be prescribed to reduce discomfort. 6. Side effects from medications. Some medications can cause muscle weakness or affect how your nerves function. Cholesterol-lowering drugs like statins may lead to muscle aches or sudden leg weakness. Sedatives or sleep aids can make your muscles feel floppy or unsteady. Blood pressure medications can sometimes lower your pressure too much, leading to weakness or dizziness. Always check the leaflet that comes with your medication. If you notice leg weakness after starting a new drug, tell your doctor right away. Never stop medication on your own without medical advice. A simple change in dosage or switching to a different drug can solve the issue. 7. Infections that affect muscles or nerves. Certain infections can cause sudden leg weakness by affecting the nerves or muscles directly. These include viruses like dengue, chikungunya, or even the flu. In rare cases, an infection can lead to a condition called Guillain-Barré syndrome. This causes the immune system to attack the nerves, leading to weakness in both legs. It often starts in the legs and may move upward. You may also notice tingling, pain, or difficulty walking. It usually occurs after a viral infection, sometimes even after COVID-19. Guillain-Barré is serious but treatable if caught early. If you've been sick recently and now feel weak in the legs, seek medical help without delay. 8. Arthritis or joint locking. Sometimes the problem isn't in the nerves or muscles, it's in the joints. Severe knee or hip arthritis can make your leg feel weak, especially if it's swollen or painful. You may suddenly feel like the leg is locking, giving way, or unable to hold your weight. This isn't true muscle weakness. It's more about pain limiting your strength. In seniors, osteoarthritis is a leading cause of leg instability. Simple treatments like hot packs, rest, or over-the-counter pain gels can provide relief. In more severe cases, your doctor may recommend physiotherapy, braces, or even joint replacement. Maintaining flexibility and strength in the surrounding muscles is key to joint stability. 9. Drop in blood pressure. When standing up, have you ever stood up too quickly and felt your legs wobble or give way? This is often caused by a sudden drop in blood pressure called postural hypotension. It can make you feel dizzy, lightheaded, or faint. Your legs may feel too weak to stand, even if your muscles are fine. It's more common in seniors, especially those on blood pressure medicines or with dehydration. Take your time when rising from bed or a chair. Drink plenty of fluids throughout the day, especially in warm weather. In some cases, compression stockings or adjusting medications can help prevent these drops. 10. Inactivity or bed rest. Staying in bed for a few days might seem harmless, but it can quickly lead to muscle loss. This is called disuse atrophy, and it happens faster than most people think. Even a short illness or hospital stay can weaken the legs. When you try to stand or walk again, the muscles may feel shaky or tired. Seniors are especially vulnerable to this kind of weakness. The good news is that strength can return with simple daily movements. Try walking around the house, doing gentle chair exercises, or stretching regularly. The more you move, the more your muscles stay awake and active. 11th, heart or lung problems. Sometimes the legs feel weak because the heart or lungs are not supplying enough oxygen. If your heart isn't pumping well, your muscles may not get the energy they need. You may feel tired, weak, or breathless, even during small tasks. Lung conditions like COPD can also reduce oxygen levels and cause leg fatigue. In these cases, the weakness isn't from the legs themselves, it's from reduced stamina. Other signs may include swollen ankles, chest tightness, or frequent fatigue. Treating the underlying heart or lung issue often helps improve energy and leg strength. If you have these symptoms, a heart or lung checkup might be a good next step. Understanding the cause is the first step toward proper care and recovery. If you or a loved one has experienced leg weakness, don't ignore it. Stay strong, stay mobile, and take good care of those hard-working legs. If you found this video helpful, please give it a like, share it with friends or family who might benefit, and don't forget to subscribe to our channel for more simple and clear health tips made especially for seniors.